6 minutes talking. Hello!
I made it.
Hooray! I was worried. How are you?
I'm good. How are you?
I'm good too. So what I was saying at the top, when's it coming to the US? Got news about that at another time. What I was saying at the top is that lots of doctors volunteered and said they wanted to do this. I didn't want anybody who I personally wouldn't allow to put a needle in my face to talk about this because I can't vouch for them. However, I've got Joanna Christou here from the London branch of the Cosmetic Skin Clinic. Do you ever do the Buckingham one? Do you ever go into that one? I don't know. There's another one.
I actually used to for many years, but recently just changed to London only because I now live out in Kent. So travelling to Buckinghamshire is a little bit too far. So I'm only based in London now.
Joanna works in the Cosmetic Skin Clinic, which is not on Harley Street, it's just around the corner from Harley Street, and she has done my Botox on a number of occasions in the past, and I absolutely do trust her with my own face, absolutely. And so that's why she's here. So you've got lots and lots of questions. I've sent some of them to you in advance because there were just so many of them, right?
Yeah.
So should we try and make our way through them?
Absolutely.
Okay. So, people are saying my sound is not fine. Can you hear me fine?
I can hear you.
Oh, okay. Well, let's see what's happened. So, so inevitably, lots of these questions are about Botox, but inevitably we veered into other areas of injectables because I think there's so much confusion over what does what. So I think quite often when people are talking about Botox, what they're really talking about is filler. And when they're talking about filler, what they're really talking about is Botox. So please, before we move on to the questions, can you just make a distinction that's really simple for people about what a classic person for Botox would be and a classic person for filler would be, or what you'd be trying to fix with each?
Okay, so the two things are both injectable treatments, but fillers are used to replace volume loss on the face. So where there is a changing contour through loss of fat pads with age, we would place a filler to create sort of structure and support. So it's something that is a completely natural molecule because we have hyaluronic acid in our body, and that's what a filler is. And you replenish this sort of structural support on the face to create that lift and that contour, which we see in youth. So that's a filler. Muscle relaxing agents, and there are lots of brands of this, are different entirely. They're actually a purified protein injected to stop muscle movement or control muscle movement. And it does this by blocking a nerve essentially that contracts the muscle in the same way that a dental anesthetic will block a nerve from feeling pain. So that's used where there are dynamic lines on the face associated with muscle contraction and movement. Common areas for that are often the upper part of the face, in the glabella, the forehead, around the eyes, but we could typically use it in the mentalis, in the chin, down the neck too, and there's lots of very clever things we can do with muscle relaxants.
So we should say that you are also an experienced dental surgeon as well, and so that's why your kind of perspective is quite a sort of rounded one. I think what lots of people have asked, as you say, Botox is a brand name. We're really talking about a kind of broad church of toxins that do kind of roughly the same thing in slightly different ways. Let's start with something that combines, I know, two of your passions, dentistry and injectable beauty treatments. So Ali Nightingale, lovely Ali Nightingale, she's one of my favorite followers. Botox for a gummy smile via dentist recommendation or a cosmetic practitioner. So tell us what she means by that, Botox for a gummy smile.
Yeah, so when people refer to a gummy smile, what they're referring to is a lip that elevates too much when you smile, and so the tooth to gum ratio is disproportionate or unfavorable. So a textbook perfect smile is when the lip elevates enough to see the crown of the teeth and just the first little bit of pink of gum, and no more than that. And that's what's considered the most aesthetic smile. Now, I do get a lot of requests for gummy smile treatment, and a lot of people do assume that relaxing the muscle, and it would be an injection here and here either side, is the most appropriate tool. But actually there are a lot of factors to consider, and sometimes structuring the lips with filler is in fact more appropriate. And sometimes it's dental work, so sometimes it's actually related to the position of the teeth, and that would therefore be the most appropriate route to go down. So the specific question from this follower of yours is an aesthetic practitioner or a dentist? Could be either. And it's a bit of a cop-out, I'm afraid, but it could be either. I think anything smile related, first maybe ask the dentist to check that the teeth are in a correct position, because if they're not, there could be some dental implication too. Are the teeth wearing out? Is there an overbite that's going to be a problem long term? And once that's been established and your dentist is happy with the tooth relationship, and it's simply to do with the soft tissue movement, then come to me and I'll assess the nerves, the muscles, the dynamic of the profile of the face, and I'll be able to recommend what is the best course of action from there.
You mentioned there about, maybe it's either, maybe it's a dental surgeon, maybe it's a cosmetic practitioner. And that brings me to one of the most asked questions. I think must be maybe 50 people asked roughly the same question, which is, how do they find the right Botox practitioner? I mean, I know what I would think, but I'd rather you say from a medical point of view. I should say that actually Joanna is a doctor. I am not a doctor, so anything that comes from me is my personal experience in the industry. Anything that comes from her is a qualified opinion. Go on.
Yeah, very, very good question, and a very important one, because the start of good cosmetic treatment is finding someone who's appropriately trained. So if it was my face, I would say go to someone who is a doctor, a dentist, or a nurse. That's the basic kind of entry point, the basic starting point. And in the UK at least, the people who have these professional registrations are registered on a public register. You can find them online, so you can verify that very, very easily. The next thing I would look at is, what is their level of experience? How long have they been doing this? And are they, quite importantly, doing this full time, or are they doing it just on the side and dabbling in it for a little? Because there is a big difference with someone who is focusing on aesthetics, making that their career. They're seeing these patients day in, day out, rather than someone who has a medical profession and is just doing a little bit here and there. And it's not to say that you can't find really high quality injectors who are doing it, very part-time, but you're more likely to be in experienced hands in someone who is doing it full-time as a career. The interesting additional point to this, and this is very, very hard to find, is your personal preferences, because aesthetics is, founded in science, but it is also an art. And every single practitioner has their own flair, their own style, their own ethos for treatment. And that's something that's really hard to sometimes pick up, on Instagrams and on, Facebook and websites and things like that. So really that comes down to patient testimonials. Are you looking for a really kind of light, natural result? Are you looking for something that's a little bit more of a statement piece? And that comes down to individual flair. And once you've found that person, it's gold dust, because then you can just build a really good relationship from there.
Yeah, I think that's really, really important, because very often, the aesthetics of something is just personal taste, right? It's like you and I talk about this all the time. When you have given me toxin here, we both say, I want my eyes to crinkle when I smile. I want my eyes to crinkle. I want them to be lined when I smile. I want you to be able to see crinkles in my eyes. Now, loads of people don't want that, and nobody's right, nobody's wrong, but there will be a doctor who will give you that, where you've got literally nothing here and it's completely smooth, if that's what you want. Whereas that wouldn't be the doctor that I would want, and they might not want you because you like a crinkly eye yourself. Do you know what I mean? And so I think it's kind of, it's important to know what you like the look of, and notice what friends have had done, or women you meet have had done. If you like that look, then that's a good place to start.
Exactly. And that comes with meeting people, having consultations with people and getting a sense for, you know, the language they use, how do they assess you, what do they recommend as your treatments and things like that. So I would certainly start with kind of making sure that the professional qualifications and experience are there, but then seek out the person that has that kind of aesthetic style. Now, my style, as you've alluded to, is very natural, very light. I like things to look, you know, confluent with your own normal anatomy, so you just look a really healthy, refreshed version of yourself, but not different in any way. And it doesn't suit everyone, you know, so, and that's perfectly fine, because I do what I believe is right, and that's a, you know, this very light kind of form of aesthetics. So therefore people like yourself who have the same belief pattern as me, we work beautifully together because we have the same understanding on these things.
I would also say, and again, as a layperson, I would also say, and I obviously always say to followers who ask me, if you go to a clinic and you talk to somebody about the treatment you're going to have, in my opinion, that person should be the person who is giving you the treatment, not a salesperson, not a receptionist, not an assistant. The person who is going to be holding the needle and injecting the toxin or the filler or whatever it is you're having, Profilo, whatever it is, that needs to be the person who has the consultation with you, because I keep hearing about people having a consultation with like a salesperson, then going off to see another person. And
Really?
for me, yeah, for me,
Oh.
that would be like a huge red flag.
Yeah, that would be a red flag for me too.
So, Michael is saying, has having Botox around my forehead and crow's feet made my under eye bag creases worse? So it sounds like he's had toxin around here, and he's saying, has it made things worse around here?
Okay, so without examining you, what I'm going to do is speak in very general terms. As a general rule, without the muscle relaxant, I'm assuming you have lines under your eyes, and that's why you have the treatment that you have. And it can be said that if you over relax these lines here, the lines under the eyes by comparison therefore look more obvious. It's a little bit like when you paint a house. If you paint just one room, the other rooms look a bit more tired and it shows up a bit more. Same thing on the face. If you over treat one area, the things that were already there and pre-existent prior to treatment can kind of show up a bit more. And this is very important in doing a full face and neck assessment, because you don't want to just have one kind of really obvious treatment. It needs to be a little bit holistic and a little bit softer. So Sally mentioned treatment around her eyes. We want the movement, we want some of the lines there. Because that is the case, there is no evidence of therefore increase of lines directly under the eyes, because the muscle is working more smoothly, and it's the same muscle, by the way, sort of underneath here and sort of wraps around the side here. So the muscle's working kind of more smoothly and in conjunction with itself, rather than having one section completely paralyzed and the other section having to possibly work a bit harder or looking, you know, more harsh.
It's like it's hitting a brick wall almost, you know, like it's kind of, the muscle is completely sort of done there, and then it's blocked, kind of moving against it. Yeah.
So that's definitely the first thing I would be looking at. And then you'd have to look at, is there volume loss, is there an actual laxity in the skin? And there's sort of lots of factors to consider there. But the first thing that springs to my mind based on the description that Michael gave there was exactly that. So I'd actually go slightly softer around the eyes and just see if that sort of suits you better.
Still here with Joanna Christou from the Cosmetic Skin Clinic, working our way through your questions, mainly about injectables. Do tear trough fillers make dark circles worse in the long run? Jess wants to know. Now, so we've had this comment. So I personally, and maybe you can set people's mind at rest, I'm scared of filler in tear troughs. I've seen them and I never like how they look. I've never had filler under my eye myself, ever, because I've just never seen it where I've thought it looks particularly great. But then maybe I just haven't identified the good stuff. What are your thoughts on filler in tear troughs?
Yeah, so number one thing I would say is I think filler in tear trough is overused. I think as soon as someone has a dark circle under the eyes, the automatic assumption is, let's put a bit of filler, and it's not always the right treatment. when I do a filler under the eyes, I'm incredibly conservative because we don't often lose a huge amount of volume under our eyes. Often it's actually the ligament that's a problem, or thinning of the skin. And there's sort of lots of, it's a very complicated area of anatomy. So there's lots of things that it could be otherwise. Now, if filler was placed, but there wasn't actually an anatomical volume loss, then you could make the tear trough look worse. You could make it look bulky. You could get what's called a Tyndall effect, where the light reflects badly off the area and makes it look darker and blue. And that, I see that quite commonly. I do quite a lot of corrective work. So that is something that I'm very aware of, because I see that coming into the clinic. But if there is a volume loss, and a little bit of conservative, well-placed filler at the right depth should just simply kind of refresh and hydrate the area. It should not be obvious. It should not be bulky. Now, I don't mind admitting I have a bit of filler under my eyes, and I do still have a little bit of a contour, a little bit of a trough there. But without it, I just have a bit of a shadow, a bit of a darkness. My eyes look a bit more drawn and a bit more tired. And with it, I still have that shape, because it's normal for a 40-year-old to have a little bit of that, but there's just a bit of a brightness, and light reflects better because the contour's slightly better, but it's very subtle, very understated. So
wow,
good tear trough filler is not noticeable, like all fillers, I would say.
I did not know that you had it there, so there you go.
Oh.
There you go. You never told me that you had it, and now I know. I'm like, actually, it does look really, really good. I'm just a bit scared of it, because when I've seen people, sometimes it's almost convex. Do you know what I mean? Like, you know, there's almost like a cushiony thing under their eye, and I just think it looks a bit bizarre. But I had no idea you had it, so there you go. Somebody is saying, could they have a resistance? There's a few of these actually. Could they have a resistance to Botox? It lasts a week on me, a week every single time. Somebody else saying it only lasts 6 weeks on them. Is that a thing?
So academically, yes, because it is possible to build a resistance in terms of the antibodies in our immune system. But in practical terms, the number of people that actually happens to is infinitely small. So what is happening? Why is there a perceived resistance? Quite commonly, I see that people have had Botox over a number of years. In their early years, they see it kicking in very quickly, being very effective, lasting a very long time, kind of doing exactly what it says on the tin, essentially. But in time, as we lose elasticity within our skin, lose volume within our face, lose density within the bones, if you just continue to use Botox, and I can't say Botox, can I? Muscle relaxant.
Toxin. Yeah.
Tell me off. If you continue to use muscle relaxants without addressing these other areas of anatomy, you're not going to get to the same result, because you're using the wrong tool for the job. So the muscle relaxant does just that. It relaxes the muscle only. It cannot replace fat, tighten skin, do all those other things. So it's quite possible that there's just something else going on. And actually, if you did one of these other modalities of treatment, that you then find your toxin is much, much more effective. Because, so for an example, if it's to do with volume loss and you replace that volume, and therefore the muscle now has its support and its anchoring and its scaffolding underneath, when you put the toxin in that muscle, it works much better, because the mechanics and the support of the muscle are there. Do you see what I mean?
Yeah.
So it's just multifactorial essentially, but it's probably not a genuine resistance. And if it is, you could just try a different brand of treatment, because I could say maybe, and I treat thousands and thousands of people, but I can say maybe I can count on one hand the number of people I've had a genuine resistance with. I've switched brand and it's worked better.
Oh, okay. So maybe it's a question of, and most doctors like you will have multiple brands on the premises, won't they? That
Absolutely.
they can kind of move around for different things. Lots of people have asked about number 11s. So number 11s, of course, are what we call the kind of, you know, the grooves here. Now, for years and years and years, I only ever had toxin injections on there and nowhere else. And that's where lots of people start, isn't it? Yeah. And so lots of people are saying about those, do they need Botox, or do they need filler, or do they need both, and can both be done on the same day?
Typically, this is a dynamic line, so it's to do with muscle contraction, and therefore relaxing the muscle with toxin is absolutely the best first step. Now, in some cases, if that frown has been pretty intense over a number of years and you have, as a result of that, got a static line, so a groove in this area that sits despite relaxing the muscle, then that, in my opinion, is where filler has a role. So what you don't want to do is fill the area while the muscle is still contracting really heavily, because it can create bulk and lumps and things like that. So the starting point is still relaxing the muscle, but then subsequent to that, you can just sort of underpin that frown with a little bit of filler just to lift it back up. And that filler actually will last a very long time. And in the meantime, you do a couple of muscle relaxing treatments. So by the time the filler wears off, that muscle is kind of under control, and that line never comes back again. So often, if you do need frown filler, it's once, if you're doing it properly and you're kind of relaxing the muscle in the meantime as well. Can it be done on the same day? Absolutely. Medically sound to do that. My personal preference is first relax the muscle, come back in,
see what happens,
see what the effect is, and then as a secondary decision, decide if we need filler or not.
Yeah, lots and lots of people are asking about filler there. I have to say, I've never really known many people have filler there. Normally it's toxin that people have there, but I don't think I know anybody who's ever had filler there. But as you say, in certain cases, if it's gone quite far, it might be of value.
Absolutely.
Could jowls be fixed with injectables, or is a facelift the only option?
Depends on the extent of the jowl in reality. So a really heavy jowl would be very difficult to treat non-surgically, and therefore a surgical lift followed by a little bit of careful filler for the contour of the face is a very nice route to go down, or, you know, like a mini lift surgically. But you could be surprised what we can achieve non-surgically, because a lot of people don't want to go under the knife nowadays. So their first point of contact is often a non-surgical practitioner. And we have skin tightening treatments, we have threads, and combining that with filler and maybe a bit of toxin can go a very long way in lifting up a jowl. Occasionally it's because there's a little bit of fat underneath the chin here, so we need to use something like cool sculpting just to take the weight off so that we can lift it effectively. But essentially, when you're looking at treating a jowl, the anatomy in that is very complicated, and therefore it's not going to be one treatment, it's going to be a combination of treatments, and a lot of it can be done non-surgically. But I would say speak to a practitioner, see what they suggest, and if they're, you know, thinking that surgery is the only route for you, then hopefully they'll be honest and they'll say that to you from day one, rather than take you down a path that then doesn't give you the result you're looking for. But really it's case by case and dependent on individuals' kind of goals and what they're willing to do as well. Because as I say, a lot of people just don't want to have surgery nowadays. They don't want to go under the knife.
Yeah, it feels like you've crossed a Rubicon, doesn't it, with the facelift? It's like it's quite a big step, you know, all that anesthetic and everything. Loads of people are asking about eyebrows, and I think this is such a kind of common thing. People asking, can they lift their eyebrows with injectables? And other people saying that they've had injectables and their eyebrows have been pushed down. So maybe if we could broach those two separately, because I have a girlfriend whose eyebrows like hit the floor practically because she'd had too much toxin. Yeah, she'd had too much toxin, and she just had to wait for it to wear off so they could lift back up again. Is that common in the wrong hands?
In the wrong hands, yes, but in the right hands, when you assess the face correctly, you're kind of intelligent with your use of toxin, it shouldn't happen. So if you do have a heavy brow, it's unfortunate, and you do just have to wait it out until it wears off, and then maybe find a different practitioner thereafter, just someone who can kind of approach it slightly differently, a little more softly, so you avoid that again. Everyone is different in the doses that they need of toxin, and some people are very, very sensitive and they catch you by surprise. So a normal dose of toxin on some individuals is just way too heavy. And when I meet someone for the very first time, I'm just super light just to see kind of what the response is to avoid that. And some people come back for their review saying, well, that didn't work. Can we put a bit more in, please? And yes, of course, that's the answer. Let's figure it out and get the dose. And others find that that's just enough and they don't need any more. And in those people, if I had done an average dose, it would have been a disaster. So I very rarely get a drop, but that's because of my particular style, and I'm very risk averse in my nature. And so therefore my practice of aesthetics is the same way. Some people get a drop because actually what they need is a filler in the upper part of the face, and it goes back to using the right treatment for the problem in hand and the previous question of how long is my toxin lasting. One reason why people do drop is loss of volume sort of through the forehead, in the temples, because this is the scaffolding for the upper part of the face. And if the muscle isn't supported and you know, got its kind of scaffolding there, it could drop with any amount of toxin. So sometimes you need to lay the foundation first and put a bit of filler into possibly the temples or the forehead before you can have your muscle relaxants. And that's, again, another thing to consider to avoid a drop on the brows.
Yeah, there was loads of brow talk, people saying that their brows had come down. You can also use toxins, of course, to lift one brow, can't you, if they're wonky, which I'm very happy to say is what I have done. So hang on, let me just look at my, so this brow is lower than that brow, and so you do that, don't you, to kind of pull it up. And that is another thing you can do. If you're kind of lopsided, if your brows are lopsided, you can just have toxin on one side. You can have a treatment, if your treatment is something else, you can have it on one side to hike one side up, can't you?
Yeah, I mean, the reality is very few of us are perfectly symmetrical. And so often when I am doing a treatment, I'm not mirroring from the left to the right. I'm being quite bespoke and quite detailed in my placement of treatment. And so yes, I mean, you've used yourself as an example. There was an asymmetry there, and we've gotten pretty decent results in creating that balance. And for you, it meant, you know, certain placement of toxin in certain areas and things like that. And in other people, it might mean something else. But often I'm quite creative in how I use these things to create symmetry. Not that symmetry is the goal per se, but balance is certainly the goal.
A question has come in the questions thread. I disabled comments so everyone could see, but questions are open. And a really good question came in that relates to what you were saying earlier about, you know, the bare minimum is that someone is a dentist, a doctor, or a nurse. Someone is saying, is a cosmetic nurse an actual qualified nurse?
You'd have to look into that, because they might use that phrase, but unless they're registered on the NMC, so the Nurses Professional Registration, which is the UK system, then they're not actually a nurse. Now, aesthetics in the UK is not a recognised subspecialty of medicine. So aesthetic nurse doesn't truthfully exist, but a nurse who does aesthetics does. Yeah. Is that clear? I'm kind of, you know, not sure. It's very hard to describe kind of these different words that people use to kind of try and demonstrate their level of qualification. So I assume it's just a nurse who does aesthetics, because there isn't aesthetic nurse as a specialist.
Yeah, and I know this is something the British Beauty Council is working quite hard on to get completely ironed out, so that these kind of woolly phrases can't be used. But you can, in the case of any nurse, ask if they are a registered nurse, if they are a state registered nurse, and if they are, then they are absolutely seen as nurses by the NHS, and that's what we want, right?
Yeah. And therefore allowed to call themselves aesthetic nurses if aesthetic is what they're doing, essentially.
Yeah. Somebody saying, my lips have really started losing shape and density. Is it possible to have lip fillers that look natural?
Is it possible? The answer is yes, because you know, lip fillers do get a bad reputation because the really bad ones are really obvious. I think that's true for all these treatments, but particularly lips. You know, everyone talks about, you know, the duck lip and the shelving and the puffiness, and, you know, lips come through the door frame before the person does. And I hear that all day long from a lot of people, but it's perfectly possible to do it very, very naturally. I would say it depends on what your goal of treatment is. Now, some people, they say they lose volume in the lips, but what they actually don't like is the appearance of lines. Now,
Right.
if you therefore then use a filler to pursue those lines, the amount of volume you might need to add to get rid of those lines then is too much. You know, it makes
Right.
do you see what I mean?
Yes.
So there might be other things to consider there, but I promise you, lip fillers can look very, very natural. So it's hard to detect though, isn't it? Because you can't see the good stuff.
Exactly. Because very often, if people have very, very obvious lip filler, I think, well, maybe that's their vibe. Maybe that's how they want to look. That doesn't mean it was done wrong. It was just done how they wanted it, I guess.
Exactly.
So Alex is asking, and this is interesting. I've never heard this before. You can tell me if this is a myth or not. I'm a runner and have been told that toxins can wear off more quickly if you exercise several times a week. Thoughts?
Yeah, I think in theory that's true. I think
Okay.
in my experience, that is true too. So the patients who I treat who are athletes, or for example, have an overactive thyroid, so their metabolism runs very high.
Okay.
Yeah, there are some cases like that where the treatments just don't last as long. And if that's something that is sort of your internal physiology, there's nothing really you can do treatment wise to counteract that. Because what you don't want to do is put a heavier dose or a higher dose of toxin, have a result that doesn't look great, but then also wears off.
Yes,
Do you
that's
see
the
what I
worst of
mean?
all worlds, isn't it?
Exactly. So we don't really have an awful lot of evidence around this because there hasn't been a lot of research in it. So I can't quote you anything formally, but certainly in my experience, I would say that that probably is the case.
Hayley is asking, tell us who you use, please. I think you're asking me. So Joanna, who I'm talking to, which is why she's here. She's here because I would not have anybody on who I wouldn't trust with my own face. There are only 3 people in my entire life who have given me toxin injections, and I'm very happy to name them. Dr. Frances Brenner-Jones, Dr. Dennis Gross in Manhattan. So Frances is in London, Dennis Gross in Manhattan, and Joanna, who is in London, which isn't to say that there aren't, 100 other doctors whose work I see all the time and admire. But if we're talking about just my face, I can't personally vouch for anyone except those 3, because nobody else has ever given me a toxin injection, so I can't say. But a good person to look at if you live outside of London or in another country, a really good person to look at is Alice's treatments guide, because she keeps a record of lots of different people in different parts of the country. I know Joanna's clinic has a branch in Buckinghamshire if you're in that part of the country, but obviously whether in Cardiff, Bristol, Liverpool, I think Alice's treatments guide is really good to have a look at, because she kind of test drives them. I can't really vouch. I would never make a recommendation of somebody who hadn't physically put a needle in my face, and I only have 3 names, and one of them's in New York. So is it true that you should start early to get ahead? I'm 35 and only seeing very fine lines. So that's Hannah. And lots of questions like that. Somebody's asking if he's too late at 28. Can we talk about this early adoption thing and the validity and value in it?
Yeah, I mean, definitely there is a lot to be said for starting early. When I mean early, I mean kind of in your early to mid 30s. Some people earlier than that do have dynamic lines that are starting to form. And so I have treated people in their late 20s, but I wouldn't treat younger than that. If you've got lines younger than that, there might be something else to consider, like, are you dehydrated? What is your skincare? Various things like that. But yes, if you start early, very light, intelligent treatments mean that you sort of age well, rather than allowing things to set in and then try to, regain it back. So I'm a strong advocate for that. I mean, I was 27 when I had my first treatment, and that was just in the frown at that time. Yeah, I actually had quite an intense frown at that time. So I've been having toxin for a while. And as a result of that, I look like, well, quite a fresh-faced 40-year-old. So, but I don't look like I've had anything done because it all moves and I look appropriate. So there really is an advantage to starting early, because you can do just these like nibbly little treatments that are very kind of refreshing and complimentary. But the danger is you don't want to start to set up a pattern of belief and behavior that thinks you should have treatment for everything. Do you see what I mean? So you need to be in the hands of a very ethical practitioner who will say no to you when they don't think something is right for you. Because if you start, finding lines, pursuing lines, fixing everything at a young age, the trajectory of that could be very bad in the years to come. Do you see what I mean? So I think it's good to start early when you do it correctly, and when you do it very conservatively, very appropriately, and therefore you will age well, age appropriately, look good as the decades go on, but do it in a very intelligent way, and not overdone. And I really do challenge my young patients, and check their motivations and how they're sort of feeling about the treatment and feeling about themselves. And if I think they're going too far, I sort of build enough trust in the relationship that if I say, actually, I think you're overthinking that, I don't agree with that treatment, they do listen to me, thankfully. So I think if you're going to pursue treatment before you're 30, by all means do, but find a practitioner who's really reputable, who knows what they're doing, who you can trust and build a relationship with over time.
Yeah, I think it's really, I think in all aspects actually of life, it's good for people to say no. So I always think it's good if you're on a beauty counter and somebody behind the counter says, actually, our blusher isn't as good as the blusher on that counter over there. or a hairdresser who says, do you know what, I prefer it when it was like this. I just think somebody who's prepared to be real with you for the greater good is always a good sign. Joanna and I keep talking about this massive dent in my head that's been there for a really long time. I've got a natural dent in my head. It's completely natural. And every time I go, Joanna and I talk about whether we should get rid of it. And every time we're like, nah, let's leave it. And I think, and we talked about the other day, didn't we? And we were like, oh, let's leave it. And we did. And I think that it's good if you start trying to fix everything, then it's an unwinnable game, isn't it? Because then you'll just find another thing that needs fixing.
Absolutely. And then psychologically, that's so detrimental, because essentially you will then never be happy. You will always find something, and it's just not, these treatments should be a joy. They should be very uplifting, very confidence boosting. It should be a real treat for yourself. If it starts becoming a stress and a chore and an endless pursuit, then that's not a good starting point, I think, for making decisions on about what to do and what not to do. So yeah, that's the only kind of caveat to that question, I would say. But by all means, start early. Love it. I did.
I didn't. I was quite old. Well, by today's standards, probably at that time it was about average. I think I was about. So it was after I wrote my first book, I think. So it would have been about 2015, somewhere around. So I was about 40. 39, 40.
Yeah, and there's no harm in starting, at that stage either, or even later than that. I have people coming to me in their 50s and 60s for the very first time. So it's about what's personally right for you. And at every stage in life, there are things that can be done. And obviously, if you're in your 20s and 30s, then everything is going to be very minimal and very dinky. And once you get a bit older and you lose more volume and you lose more elasticity in the skin, then we start talking about, treatment plans that are a little bit more, robust and more involved. But any age is appropriate, really. I mean, my oldest patient is 94, 95.
Wow.
I know, I love her.
Wow, how cool.
So age is irrelevant, put it that way.
Lots of people are saying, will my face change forever? Will there be parts of toxin that are irreversible long term?
I don't think I understand the question. Will my face change forever?
So people are asking if they stop, a few people have asked this, if they stop having toxin, if they don't like it and they stop,
Got it.
will there be a permanent shift? Will there be a permanent change that they'll never be able to undo or reverse?
No, I mean, there's a point at which when you stop using toxin, the muscles will regain the strength and you'll basically go back down to baseline as if you'd never had it. But how quickly that happens depends on how long you've been doing it for. So if you've only done it once or twice, you decide that toxin isn't for you, you'll revert down to your baseline very, very quickly. If you've been doing it for years and the muscles are not as strong as they used to be, even after the toxin wears off, there'll still be an impression of the treatment being there and effects there because the muscle is in a relaxed state. But as those months and years go on following the final treatment, you will absolutely just hit baseline again at a certain point.
Yeah. Yeah, you'll kind of go back to normal. Of course, your normal is different in 2 years' time than it is before because your body is growing and aging.
Your body is different, yeah.
People are asking, does Botox, do toxins or anything like it work on necklines?
Depends what they mean by necklines. Are they referring to horizontal lines like this, which are bands across the neck, or are they referring to these sort of lines here? I'll talk about both.
Okay.
So these lines here, which are sort of vertical to do with this muscle here, can you see it? That's definitely a toxin treatment. That's a very thin muscle in the neck called platysma. It sits all the way up to the lower part of the face here. And if you relax that muscle, you get kind of a bit of a lift. So it helps with defining the jawline and it helps with just sort of springing up this area here. So it deals with lines like that. Horizontal lines are slightly different. They're actually more to do with underlying anatomy rather than the muscle. So a toxin is less effective for that. It can still help, but typically on that.
So like this sort of thing.
Yeah, and these ones I've got here, I don't know if they're picking up in the light there, but you can just about see them. So that generally does better with Profilo, for instance, or something like a tioxane RHA1. So these very kind of light hyaluronic acids, because what you don't want is bulk on the neck. What you don't want is a line of filler that sits across the neck where the line is gone, but then you've got a sausage of filler in the neck. So you need to use a very, very delicate, very light product that will sort of diffuse into the area and condition the skin rather than volumize it. So those are things I'd be looking out for when we're deciding what's the correct approach.
You've said the P word. I have to talk about Profilo. So I've never had Profilo. I probably will at some point because so many people ask me about it. I feel like I need to form an opinion, but I've never done it as yet. But what I find very peculiar about Profilo is the number of women who send me DMs saying, I really, really, really want Profilo. What do you think about it? But I would never, ever, ever get toxin. And I don't understand that. I would love to know the mentality of that. There is a cultural thing where people are, I think, maybe snobbish and judgmental about toxin and to a lesser extent, maybe filler, but fine with things like Profilo, which are still injectables. Do you find that culturally in the clinic? And where would you recommend Profilo over the others?
I really love Profilo. I think it's quite unique in its behavior and I use it a lot every single day in clinic. I do get a lot of people coming in saying they want Profilo, but they will never ever have a toxin or a filler.
Yeah,
and
so
it is interesting, but the driver behind it, in my experience, is that Profilo is seen as a very natural treatment.
Right.
It's seen as something that's not going to change the face. Whereas there's a certain amount of fear related to toxin and filler in that regard. Now, a lot of those are preconceived ideas about, bad treatments they've seen in the past. So by the time I assess them and talk to them, often I can break down a lot of those fears and we can have a more kind of all-rounded conversation. But Profilo is a beautiful treatment. It sits in the category of kind of being about skin health, collagen boosting, elastin production, because it won't add volume, it won't change the shape of your face, it won't affect how the muscles contract and move. It's literally about getting hydrated, healthy, fresh skin. It will deal with fine lines on the surface of the face, but it won't replump and lift and support the face. So as a standalone treatment, it's fantastic. And actually, this is one of the treatments that my young patients do a lot, because they're starting to bank collagen as part of this investing in aging well. Profilo really sits in that kind of category of being a very good treatment for a younger person. But also in an old person who has a crepier skin, Profilo works very profoundly on that too. Usually they will need a little bit of filler, ideally to create that underpinning and support, so you're not relying wholly on Profilo, but it does go a long way in those cases too. Now, you need enough of it. If you undertreat, it will be underwhelming for sure. So initially, most people do require 2 doses about a month apart. And then depending on your response to treatment, there'll need to be maintenance and top-ups of that. Most of my patients do it once every 6 to 12 months. And it does depend on, as I say, what other treatments they're doing and what is their main goal for that treatment. But yeah, I think Profilo is it's kind of the newest thing we've got, the newest injectable, because there's always fillers coming out, but they're all ultimately about volume replacement, whereas Profilo is purely about, you know, collagen stimulation and elastin growth and things like that. So it's very unique in the way it behaves. So I'm a big fan. And Sally, yeah, let's have that conversation in private one day.
I will. So what I will say to people is, if after a proper medical consultation with Joanna about Profilo, if she thinks it's worth doing, so many of you ask me about it, I will do it. I will pay for it. I will fill it. I will film it. I'll film it, I'll pay for it, because I know you're interested in it. If you think that would be of interest to you, for me to go and have Profilo just as a regular client, for Joanna to do it, and you would like to see what that looks like, a before and after and so on, I will do it if there is sufficient interest, because I'm not scared of the needles, because obviously, you know, I've had plenty of needles in my face. It's not that. It's just, if people are sufficiently interested and Joanna feels there'll be enough of a result, I'll do it and I'll post about it. Let me know your thoughts. Somebody is saying, toxin in crow's feet gave my friend bags under her eyes. Will they go once the toxin wears off?
Right, so this can happen again in over-treatment, because the contraction of this muscle here is involved in lymphatic drainage of the fluid from under the eyes. So if you over-relax this muscle and the fluid therefore can't be released, then you can get very puffy under the eyes. Usually that kind of person always is puffy up here too. So just check that there isn't a heaviness up there as well. But it will completely resolve once the toxin wears off. That will not be a permanent thing. What your friend can do in the meantime is a little bit of gentle lymphatic massage. So at night before bed, take a very light eye cream and just massage from the inside out. The lymph node drainage is on the side of the face. So if you just sort of draw the fluid away, you can kind of encourage that mechanically to clear, because the muscle can't do it itself. Cold compress is very helpful in that case, and sleeping slightly elevated. So put an extra pillow under the head, because if you allow gravity during the night to help drain the fluid, I mean, it's a little bit of an anecdotal thing, but it does, all these things put together do make a difference in how much fluid does collect there. Some people are fluid prone anyway and prone to puffy eyes, and it's to do with hormones and diet and hydration and all sorts of things. So if you are that person, then those things I've just suggested can also help with that.
Yes, some people very sweetly say of me, she's had so much filler around her eyes, that's why she's so puffy in the face. I haven't had any filler around my eyes.
No.
I'm just puffy. Sorry. You could be nicer about it. Lots of people are saying, what are the long-term risks of toxin injections? Are there long-term risks? What do we know?
So we only know as far as the data allows us to know, which is a good, 30 years or so. And in that data long term, we don't have any negative sequelae at all. What we don't have, though, is a generation of people who are in their 20s, who are now 80 and 90 years old, who have had toxin consistently over their lifespan. So until we get that cohort of people, that generation of people, which will be in another 50 years or so, we won't be able to 100% say that there is no long-term risk. And that is the truth. And anyone who tells you otherwise is lying. But for the data that we do have, which is pretty decent over a number of decades, and thousands and millions of people have had these treatments, there is no damage long-term to muscles, to nerves, to any anatomy otherwise in that area at all. So it's as safe as it can be.
And any doctor or nurse or dentist or any other practitioner you see should be letting you know that there are always going to be risks and side effects that are potentially possible. And as you say, if you go and see a practitioner who says everything is perfect, there is nothing ever to think about, then you're in the wrong hands.
Yeah, I would say so.
Lots of people saying they are frightened of injectables in their face, frightened of the practice of it, frightening of it happened on the day, will it hurt? I suppose, look, speaking as a layperson, I think you can only, it's so personal, isn't it? It's I have tattoos, I have been waxed. There are lots of things that I have done to myself that are painful. Had 2 babies without pain relief. If you are the kind of person with a high pain threshold, then you're just that kind of person. And if you're a person with a low pain threshold, that's probably not going to change when you have toxin injections. And I remember the first time I came to see you, I can't remember what you were doing now. I can't remember whether you were putting filler there or toxin there. I can't remember, but you couldn't believe that I didn't want any anesthetic cream. And I think, I think it's just so personal, isn't it? It's so personal. Yeah. And things either hurt you or they don't hurt you.
Yeah, pain is incredibly subjective, and what is nothing to one person is an ordeal to someone else, and you can't dictate that. So I always offer anesthetic cream, and some people will take it for absolutely every single treatment they have, and some people will take it for nothing at all. It's not for me to decide what's right for the individual. I mean, I would say these are medical grade treatments. It's not a relaxing, pampering facial. Unfortunately, there is some degree of discomfort. Of course, we try and manage that as best as possible, and so for the majority of people, it's a walk in the park. They really don't find it unbearable in any way at all. I don't think I've ever had to stop a treatment for anyone ever, but because a good practitioner will manage that for you. So yeah, it's hard to promise you that it will be easy and plain sailing, but I think again in a good medical grade clinic, in good experienced hands, you should feel comfortable and well looked after, and therefore the experience of it should be less stressful for you, hopefully.
Yeah. I mean, the single most annoying thing for me, I get no pain, no bruising, no swelling. The single most annoying thing for me is I have to have my makeup wiped off, and I might have a meeting afterwards that I want to put my makeup back on. And then I go, oh, damn, I didn't bring any tinted moisturizer, and I have to go to John Lewis and buy something to put it back on. And I'm so annoyed we've run out of time. We've gone on for such a long time. And look, there are so many questions left. Will you come back? People who are watching and people who are watching this after we finished recording, would you be interested in Joanna doing something more regular, like once every 3 months, maybe coming back and continuing this conversation, maybe talking about other treatments? I don't know. Let me know, and let me know about the Profilo thing, whether that's of any interest. Because we've answered loads of questions, we still haven't even scratched the surface. So Joanna Christou from the Cosmetic Skin Clinic, who has literally injected my own face in her time, so I trust her implicitly. Thank you so much for joining me. Will you come back if people want to hear more?
Absolutely. Thank you for having me. It's been fun.
Yeah, it's been absolutely lovely. I hope you all have a good evening, everyone. And my dog didn't go mad. I don't know what my husband's done. It's like he must have harpoon gunned her when he walked through the door, because she hasn't made loads of noise. So I forewarned you needlessly. Lots of love, everyone. Lovely to see you all. And I will, of course, save this permanently on my Instagram wall so you can refer back to it, send it to people. And if you have questions in the meantime, send them to me and I'll bank them for a future chat. Thanks, Joanna. Have a lovely evening. Lots of love,
You
everyone.
too. Thank you.
Enjoy your dinner.
Bye.
Bye.
Bye.